I want you to do something for me right now. Not in a minute, right now. Look down at your ankles. Really look at them. Do they look puffy? Does the skin feel tight? Almost like it's been stretched from the inside. And here's the one that most people recognize immediately when you take off your socks at the end of the day. Is there a deep ring pressed into your skin? That indented line that takes a good 20 minutes to fade? If any of that sounds familiar, I want you to stop what you're doing and watch this entire video, because what I'm about to tell you is something that most doctors, and I say this as a physician myself, simply do not have the time to explain to you in a regular appointment. Here's what happens to most people over 60 who come in with swollen ankles. They get scared, understandably scared, because everything they've ever heard points to one place: the heart or the kidneys or some kind of serious circulatory disease. So they go to their doctor, they get blood work done, they get an EKG, maybe an echocardiogram if they're lucky enough to have a thorough physician, and the results come back. Everything looks fine, and the doctor says, it's probably just the aging process. Try to move around more, drink more water, elevate your legs in the evening. And that's it. Appointment over. And you walk out of that office with the same swollen ankles you walked in with. And now you have something worse on top of it. You have no explanation. And when you don't have an explanation, your mind writes one for you. And the stories our minds write at 2 a.m. are never good ones. Today I'm going to give you that explanation. I've been practicing medicine for over 20 years, and in those 20 years, one thing has become crystal clear to me. Our healthcare system is exceptionally good at handling acute emergencies. It is not very good at listening to people who have persistent, chronic, non-life-threatening symptoms that quietly steal their quality of life every single day. Swollen ankles, heavy legs, that exhausted, waterlogged feeling in your feet before noon. None of that shows up on a blood panel, but it is real, and it has a solution. So let me tell you something that is almost certainly sitting in a gap nobody has filled for you yet. The vast majority of ankle swelling in people over 60 has absolutely nothing to do with your heart, nothing to do with your kidneys. It has to do with a system that conventional medicine almost completely ignores. A system that is working inside your body right now, every second of every day, and that after 60 starts to slow down, get sluggish, and get backed up. That system is called the lymphatic system, and in the next several minutes, I'm going to explain exactly what it is, why it gets blocked, and most importantly, how you can activate it at home in under 5 minutes a day with a habit so simple you are going to wonder why nobody ever showed you this before. Let's start with how your body actually handles fluid. Picture two separate plumbing systems running side by side through your body. The first is the cardiovascular system. The heart pumps, blood travels through arteries out to your tissues, does its job, picks up waste, and returns through the veins. That system has a powerful pump, your heart, keeping everything moving continuously. Now, right alongside that system, imagine a second network of much thinner, more delicate tubes. Think of them as your body's drainage system, the equivalent of a sewer line running parallel to the main water supply. Their job is to collect all the fluid that naturally leaks out of blood vessels into the surrounding tissue to gather up cellular debris, toxins, bacteria, damaged cells, and carry all of it to your lymph nodes where it gets filtered and cleaned before returning to your bloodstream. That is your lymphatic system. And here is the difference that changes everything. Unlike your cardiovascular system, the lymphatic system has no pump of its own, no heart equivalent. It depends entirely on the movement of your muscles to function. Every time you walk, every time you climb stairs, every time you flex your calf, your muscles squeeze those thin lymphatic vessels like you'd squeeze a tube of toothpaste, pushing lymph fluid upward toward your lymph nodes. When your muscles move, the fluid moves. It is that direct. Now, do you see where this is going? After 60, many people move considerably less. Not out of laziness, I want to be clear about that, but because their knees hurt, because they're worried about falling, because the body simply doesn't demand movement with the same urgency it once did. And when movement decreases, lymph fluid stagnates, it thickens, it slows, and the fluid that should be continuously collected and removed begins to pool in the tissue. And where does it pool first? In the lowest points of the body, the ankles, the feet, the lower legs. That tightness in your skin at the end of the day, that puffiness around your ankles, that indented ring from your sock, that's not your heart failing you. That is your drainage system backed up, and it is asking you for help. Before I go any further, I need to stop and ask you a favor. If what I'm describing sounds like your experience, if you're watching this and nodding along because you recognize yourself in what I'm saying, drop a comment below and tell me what state you're watching from and how old you are. I want to know who is on the other end of this screen, because this channel exists for real people dealing with real problems, and every comment you leave helps me understand what else you need to hear. Now, I also need to talk about something that I take very seriously as a physician, which is knowing when swelling is an emergency. Because there are situations where swollen ankles are not the lymphatic issue I've been describing, and those situations require immediate medical attention, not a YouTube video. Go to the emergency room today, not tomorrow. If the swelling came on suddenly in one leg only and appeared within hours, that pattern can indicate a deep vein thrombosis, a blood clot, and that is a medical emergency. Go immediately if the swelling is accompanied by shortness of breath, chest pain, or a racing heart. That can be cardiac. Go if the skin over the swollen area is red, hot to the touch, and you have a fever. That may be an infection requiring treatment. And go if you elevate your legs for 30 full minutes and there is absolutely no improvement whatsoever. If none of those warning signs apply to you, if the swelling is in both legs, if it's worse at the end of the day than in the morning, if it improves when you rest with your feet up, and if your doctor has already checked your heart and kidneys and everything came back normal, then what you are most likely dealing with has a name: lymphatic stasis, the medical term for fluid that has stopped moving. And lymphatic stasis responds extraordinarily well to the right daily habits. I want to take a moment here to explain something that goes beyond the physiology, because I've sat across from hundreds of patients, over 60, who came into my office with swollen ankles and fear in their eyes. Real fear. The kind that builds when you've been living with an unexplained symptom for weeks and nobody has given you a clear answer. I've heard the same words more times than I can count. I'm scared I'm going to end up bedridden. I don't want to be a burden to my family. Is this the beginning of the end? Every time I hear those words, I feel the weight of how much our system has failed that person, not through bad intentions, but because the average primary care appointment in this country runs about 15 minutes, and there is simply no room in 15 minutes to explain the lymphatic system. Here is what I want you to understand. Chronic fear is not just an emotional experience. When you live in a state of sustained anxiety, your body produces elevated levels of cortisol, your stress hormone. And chronically elevated cortisol increases systemic inflammation, suppresses your immune response, and yes, it can actually make fluid retention worse. The information I'm giving you today isn't just for your ankles. Understanding what's happening in your body, having a clear model instead of a terrifying void, is genuinely therapeutic. When you understand, you stop being a victim of your body and you start working with it. That shift matters. Now let me tell you why this gets worse after 60 specifically. It isn't just one thing, it's several things happening at the same time. First, the lymphatic vessels themselves lose elasticity as we age. Just like arteries, just like skin, these vessels become stiffer and require more stimulation to move fluid efficiently. Second, muscle activity decreases, often in ways we don't even notice. More time sitting in front of the television, avoiding stairs, shortening walks because of joint pain. The sedentary time accumulates invisibly. Third, and this surprises most people, chronic mild dehydration. After 60, the sensation of thirst becomes less reliable. Many simply don't drink as much water as they used to without realizing it. And this is critically counterintuitive. When you're dehydrated, lymph fluid becomes thicker and moves even more slowly. Drinking more water does not cause swelling, it actually helps drain it. Fourth, heat. Many people find their ankle swelling dramatically worsens in summer. Heat dilates blood vessels, which increases the amount of fluid that leaks into tissue, overwhelming an already sluggish lymphatic system. Now you're seeing the full picture. It isn't one problem. It's four converging factors that collide at exactly the stage of life when your body is least equipped to compensate for them. But here's the part I genuinely love telling people. This system responds beautifully to simple stimulation. You don't need medication. You don't need expensive equipment. You don't need a gym membership. You need 5 consistent minutes every morning and the knowledge of exactly what to do with them. Here is what I call the morning drainage protocol. You are going to do this every morning before you get out of bed. You don't need special clothing, any device, or even to stand up yet. Step 1 is position. Before you do anything, take 2 pillows and place them under your legs so that your ankles and calves are elevated above the level of your heart. If you have one thick pillow, that often works fine on its own. The principle is simple. Gravity is now working for you instead of against you. Lymph fluid flows downhill. By elevating your legs, you are giving it a downhill path toward your torso where the system can drain far more effectively. Stay in this position for at least 1 full minute before you begin any movement. Step 2 is the ankle pump. It sounds almost too simple to matter, yet it is one of the most well-documented therapeutic techniques for activating venous and lymphatic return in the lower extremities. With your legs still elevated, flex your feet toward you, pulling your toes up as if you're trying to touch them to your shin, then push them away, pointing your toes down. Up and down, slow and rhythmic. No forcing, no straining. Do this for a full 60 seconds. Inside your leg, your calf muscles are contracting and releasing repeatedly, and with every contraction they physically squeeze the lymphatic vessels, pushing fluid upward toward the lymph nodes in your knee and groin. After the ankle pumps, add ankle circles, 10 rotations clockwise, 10 counterclockwise. This mobilizes the more superficial lymphatic vessels around the ankle joint, which tend to be the most chronically congested. Step 3 is diaphragmatic breathing. This is the piece that surprises people the most. Your diaphragm, the large dome-shaped muscle that powers your breathing, also acts as a secondary pump for your entire lymphatic system. When you inhale deeply, the diaphragm drops down toward your abdomen. When you exhale, it rises. That rhythmic movement creates pressure changes inside your chest and abdomen that literally draw lymph fluid up from your lower extremities toward the thoracic duct, the main collecting channel of the entire lymphatic system. Think of it as the central drain of a bathtub. You can work on all the smaller pipes you want, but if the central drain is closed, nothing moves efficiently. Deep breathing opens that central drain. Here is how to do it while continuing your ankle movements. Inhale slowly through your nose for 4 seconds, feeling your belly expand outward, not your chest. Hold for 2 seconds. Then exhale slowly through your mouth for 6 to 8 seconds, emptying your lungs completely. Repeat this 10 times. That slow, deep breathing also activates your parasympathetic nervous system, your rest and repair state, which reduces systemic inflammation and improves vascular tone. That's a significant bonus that extends well beyond your ankles. Step 4 is the ascending massage. After your 2 minutes of movement and breathing, sit up on the edge of your bed. Using both hands, apply gentle but firm pressure starting at your toes and slide your hands upward toward the ankle, then up toward the calf, then toward the knee. Always upward, never downward. Direction matters because lymphatic vessels contain one-way valves, just like veins. Those valves allow fluid to move only in one direction, toward the heart. If you massage downward, you work against those valves. If you massage upward, you push fluid in the direction it is designed to travel. The pressure you need is lighter than you might expect. Think of wiping down a countertop. Enough to make contact and glide, not enough to press into the muscle. The lymphatic system is superficial. It runs just beneath the skin. Spend 1 minute on each leg. Total time, 5 minutes. 1 minute of elevation, 2 minutes of movement and breathing combined, 2 minutes of ascending massage. If you do this every single morning for 3 weeks, here is what the evidence and clinical experience tells me you will notice. In the first week, you'll find that your ankles in the morning are less puffy than they used to be, and that it takes longer into the day before the swelling starts to build. In the second week, the heaviness in your legs during the day begins to ease, and the difference by late afternoon is noticeable. By the third week, the overall pattern has shifted. The swelling no longer reaches the levels it did before, and the skin around your ankles feels less stretched and more supple. I'm not describing a miracle. I'm describing basic physiology applied consistently. The science supporting manual lymphatic drainage and muscle activation techniques is well established. This is not fringe medicine. This is applied physical therapy accessible to anyone, requiring nothing but 5 minutes and follow-through. Now I want to give you 5 additional habits that will either reinforce the protocol or undo it completely depending on whether you follow them. Hydration is the first and most critical. Drink between 6 and 8 glasses of water per day, roughly 1.5 liters to 2 liters, unless your physician has specifically told you to restrict fluids due to a cardiac or kidney condition. If that restriction applies to you, follow your doctor's guidance. For everyone else, start your morning with a glass of warm water before coffee. Before anything else, lymph fluid is mostly water. Without adequate hydration, it thickens, slows, and stagnates. The second habit is distributed movement throughout the day. Set a timer if you have to. Every 45 minutes to an hour, stand up and take at least 10 steps, even if it's just to the kitchen and back. You don't need a walk. You just need to prevent your legs from staying completely still for hours at a stretch. Every time your calf muscles engage, even briefly, the lymphatic pump reactivates. The third habit is heat management. Hot baths, direct heat on the legs from radiators or heating pads, heavy socks in warm weather, all of these dilate blood vessels and increase fluid leakage into tissue. If swelling is a problem for you, heat is working against you. Cool temperatures, on the other hand, help constrict vessels and reduce filtration. This is especially relevant in summer months when many people find their swelling significantly worsens. The fourth habit concerns sodium. Salt causes the body to retain water. I'm not telling you to eliminate it entirely. That creates its own imbalances. But if your diet includes a lot of processed foods, deli meats, canned soups, or restaurant meals, all of which tend to be extremely high in sodium, there is a direct connection between that sodium intake and your ankle swelling. Reducing added salt is often one of the fastest-acting changes a person can make. The fifth habit is how you sleep. Elevating the foot end of your bed by about 4 to 6 inches, or simply placing a thin pillow under your feet, gives your body 7 or 8 hours each night to passively drain the lymph that built up during the day. While you sleep, gravity does the work for you. Don't waste that opportunity. A word about compression socks, because your doctor may have already mentioned them, or you may have seen them at the pharmacy. They work, but they are frequently used incorrectly, and the mistakes turn them from a helpful tool into a useless one, or worse. The most common error is putting them on after the swelling has already started, in the middle of the afternoon when your ankles are already puffed up. That is like trying to squeeze toothpaste back into the tube. Compression socks need to go on in the morning before you stand up, while your tissue is still in its baseline state. The second mistake is choosing the wrong compression level. Over-the-counter options at pharmacies are typically light compression, which is safe for most people. If your doctor has prescribed medical-grade compression, those require proper fitting and professional guidance because at higher levels they can be counterproductive in certain conditions. And the third mistake is treating compression socks as the whole solution. They are a support tool. If you're not combining them with movement, hydration, and the morning protocol, the moment you take them off, your ankles go straight back to where they were. I want to close with something I genuinely believe, and I want to say it directly. You are not too old for your body to improve. I don't care if you're 62 or 82. The body retains an extraordinary capacity for adaptation at every stage of life. What changes with age is not the ability to get better. What changes is the time it takes and the importance of being consistent. Our culture has a tendency to over-medicalize problems that could be managed with the right education, the right habits, and someone willing to take the time to actually explain what is happening. Not every symptom is a disease. Some symptoms are a system asking for attention. You deserve that attention. You deserve a clear explanation, not a shrug and a pamphlet. And you deserve to know that 5 minutes every morning, 5 deliberate, informed minutes, can meaningfully change how your body feels every single day. Start tomorrow morning before you stand up. Pillows under the legs, ankle pumps, deep breathing, ascending massage. Do it every day for 3 weeks and then come back here and tell me in the comments what changed. I genuinely want to hear from you. If this helped you, please share it with someone you care about who is dealing with the same thing. A friend, a parent, a spouse. The information that changes lives does no good sitting unwatched in someone's recommendation feed. And if you want to keep learning about how to take care of your body after 60 with honest medical information and no shortcuts, subscribe to this channel. A final note before you go. Everything I have shared in this video is for educational and informational purposes only. It is not a medical diagnosis. It is not a substitute for the advice of your personal physician. It is not personalized medical guidance. Every person's health situation is different, and what applies broadly may not be appropriate for your specific circumstances. If you are experiencing sudden swelling in one leg only, accompanied by shortness of breath, chest pain, or fever, please seek emergency medical attention immediately. For any concerns about your health, always consult a qualified medical professional.